This is a plain CT scan brain of a 10 years old male baby. The patient is a known case of craniopharyngioma. He was operated upon about 6 weeks ago. Now he has presented with pus discharge from the site of wound and non-uniting craniotomy flap. Now first let me explain you the craniopharyngioma. It is intracellular as well as in supracellular location. It is hypodense and is predominantly cystic. Curvilinear irregular calcifications are seen along its walls. Please see that it is extending into supracellular region. 20% of the craniopharyngiomas are supracellular in location, while 10% are intracellular, 70% are supracellular and intracellular in location. 54 to 75% are cystic. These contain the cholesterol, keratin, and the necrotic debris. Marginal calcifications are present in the 70 to 90% of childhood craniopharyngiomas. Now I come on to this craniotomy flap. Please see that this is displaced inwards and downwards. There is overlapping of the bones. There is pneumocephalus. Air is entering from the skin wound intracranially and comes to lie along the anterior surface of the right frontal lobe and in the anterior part of the interhemispheric fissure. There is mild dilatation of extra and intracerebral CSF spaces. For the age of the child, this is suggestive of the residual effects of the insufficient nutrition. This is known as reversible cerebral shrinkage. Same findings are present in the cerebellum as well. Cerebellar folia are mildly thinned. This is the bone window. There is overlapping of the craniotomy flap. It is depressed posteriorly. Now please see these ill-defined erosions here. The rest of the bone margins are intact. This is suggestive of the osteomyelitis in this region. Again, the bone margins are intact. This is 3D reconstruction. This is the site of osteomyelitis here, this one. The bone flap is depressed and is displaced downwards. This is the corneal scan of the patient of craniopharyngioma. This is the sagittal scan. Please observe depressed craniotomy flap with overlapping in its lower part. And this is the craniopharyngioma. Pituitary fossa is widened. There is intracellular and supracellular mass, which is predominantly cystic and contains marginal, curvilinear, and irregular calcifications.